Now, health officials are tonight putting the spotlight on Nairobi's densely populated neighbourhoods after 5 cases of COVID-19 were detected in Dandora estate. The Dandora cases have been reported just days after Kawangware and Eastleigh areas began registering a high number of infections. Enock Sikolia reports on the growing concern that is fueled by cases of patients who spread the virus without showing any symptoms.
As the government was making its daily report concerning the spread, management and response to COVID-19, Kamau Irungu was left a worried man. The fast-spreading virus was slowly but surely making strides deep into the Kenyan population. He sells farm produce at Kawangware market, where many people continue to overlook guidelines issued by the government. Health experts are worried that the virus is spreading to densely populated areas with limited access to sanitation and healthcare services. Dandora is the latest such a state to be hit by the disease. 5 out of the 16 COVID-19 cases announced by the government are from the estate.
These 16 positive were picked out from among communities by our surveillance teams.
Health officials say the source of infection was a lady who showed no symptoms of the disease but ended up infecting 4 of her 9 contacts. The 4 were confirmed positive after all her 9 contacts were subjected to laboratory tests. The lady had no fever, no coughs, and no chest pain. She only discovered she had the virus when she visited a local clinic for a chronic disease she has been battling for some time now. The government is grappling with establishing contact made by the other 4 patients.
It tells that if you do not withdraw those people from the town, then each of them will go and multiply by 4, and there goes the exponential figures.
The government recently sounded an alarm over a surge in community transmissions as the number of COVID-19 cases continued to rise. Community transmissions appear to have established roots in Eastleigh, Ruaka, Kawangware and now Dandora.
It is something in your neighborhood. It is something that is being carried by a brother, a sister. It is something that is within a friend that you have.
But some residents are yet to change course. In Kawangware, for example, the social distancing policy is a myth. We spotted many people standing or sitting in groups, most of them having relegated this crucial directive aimed at reducing the virus from spreading in the communities. Some have no face masks, pieces of cloth that stops droplets from an infected person from reaching someone's mouth, eyes or nose. Let's, for example, focus on these 2 ladies in the crowd. They have no face masks, even as they maneuver through the congested area. We noticed one was carrying a little baby.
Yeah, we've been here in Kawangware and we have seen some members of the public not adhering to the guidelines issued by the government as a way of curtailing the spread of coronavirus in the country. Some are not wearing face masks in public.
Some had rolled their masks down their chins while some had them in their pockets.
Unaitwa nani? Anet, sisi tunatoka runinga ya Citizen. Lakini tunaona hauna mask kabisa. Hauogopi?
Naogopa tu. Nilikuwa nako lakini kalikuwa nini? Kalishikwa na matope nilipigiwa asubuhi.
Mtatizo ni vile nilikuwa naongea na wewe sasa shida kuongea. Nilikuwa na shida kidogo nikiongea nikiweka hivi sasa naye hiyo nini pumzi inafika inarudi kwa,
lakini tumekuona ukipita pale tunaona unapitana na watu na hauna mwenzako amevaa face mask.
Sasa ni vile nilikuwa naye ndio nilikuwa nivae lakini nikawa nimesahau kidogo.
The statements that summarize the challenge of controlling the spread of the pandemic that has disrupted the entire planet. Enock Sikolia, Citizen TV, Nairobi.